Hi, today I will walk you through on how to drain an indwelling pleural catheter IPC using this type of drainage bottle. Let us go through the various parts of the catheter. This is the site where the catheter is inserted, and there may be stitches in place for newly inserted catheter. Most patients with catheters in place for longer than 2 weeks will have their stitches removed. This is the catheter or tube. This is the catheter valve with the valve cap. I want to remind you that the skin at the insertion site may be infected and bacteria can enter the chest through the catheter. It is very important to keep the dressing at the insertion site clean. Let's go through the steps on how to drain the fluid using this type of drainage bottle. The vacuum inside the bottle provides suction for the drainage of the fluid. Remember that it's important to practice good hand hygiene before and after handling the catheter. Clean your hands with soap and water or hand sanitizer. Do not touch any non-sterile areas like your hair, face, clothes or phone after cleaning your hands. Gently remove the existing dressing. For the foam dressing, remove the transparent dressing. Uncoil the catheter. Then remove the foam dressing. For the gauze dressing, remove the transparent dressing. Uncoil the catheter. Then remove the gauze dressing. Examine the skin around the insertion site to check for redness, swelling, pus or blood discharge, loose or broken stitches. Also, make sure that the cuff is not visible outside of your body. Clean the tabletop with a disinfectant wipe. Clean your hands thoroughly. Open the pouch containing the IPC dressing pack and bottle kit. Open your dressing pack by peeling the pouch apart. Take out the yellow disposable bag. Open it up and place it on the chair next to you. Next, take out the blue pack and place it on the tabletop with the tape facing upwards. Carefully remove the tape and unfold the blue wrap by pulling only at the edges or the corners to create a sterile feel. The blue wrap serves as a sterile surface for you to place the contents of the pack. Make sure that the contents remain within the blue wrap. Prepare an additional pack of alcohol swab. Open it up and place it at the corner of the blue wrap. Clean your hands thoroughly and put on the sterile gloves by touching the cuffs only. It's important that your bare hands don't touch the outside of the gloves, which will later be used to touch the sterile items. After wearing the gloves, don't touch any non-sterile areas like your hair, face, clothes or phone. Separate and lay out the items in the blue wrap. You should have one blue clamp, one valve cap, one transparent dressing, 4 alcohol swabs, 1 foam dressing, gauzes, 1 bottle adapter with valve cap, and 1 pair of gloves which you are already wearing. The blue clamp is for emergency use when the catheter is accidentally cut or damaged. Now, take out the bottle from the pack and do 2 checks. 1. Check the white clamp at the top of the bottle to make sure that it's securely clamped to maintain the vacuum in the bottle. 2. Check the bottle indicator and make sure that it is depressed. If it is fully raised, then the vacuum in the bottle has been lost. Do not use the bottle and change to a new one. Remove the blue tape from the bottle while holding on to the drainage line and access tape so that they do not touch the non-sterile tabletop. Remove the cover from the access tape and place it in the middle. Sometimes the cover falls off from the access tape. You can still use it, but just make sure not to touch it. Tear open 2 packets of alcohol swabs and place them on top of the blue wrap. Peel open the pack containing the valve cap and carefully place it in the middle. Remove the valve cap and throw it in the waste bag. Clean around the opening of the exposed catheter valve with a new alcohol swab, but don't try to clean the inside of the catheter valve as this could damage the valve and allow air to enter or fluid to leak. Then, Gently insert the access tip into the catheter valve and twist until you hear or feel a click. Slide the white clamp to its open position and the bottle is now ready for draining. Push the slider forward or press the button to drain the fluid. You can control the flow of the fluid with the slider or the button. Push the slider forward or gently press the button to gradually increase the flow of the fluid. While the draining is happening, it's normal to feel some mild discomfort or pain. You can manage the pain in two ways. 1. Slow down the draining by pulling the slider back or release the button slightly. 2. Stop the draining completely by pulling the slider back to its original position or release the button completely. You can continue with the draining after you feel more comfortable. Monitor the fluid volume by checking the scale on the bottle to make sure you do not drain more than 1000 milliliters of fluid a day. Some of you may drain less than 1000 milliliters of fluid each time. After you finish draining, twist slightly to unlock the access tip and gently remove it from the catheter valve. Use a fresh alcohol swab to clean the exposed catheter valve gently and thoroughly. Cover the exposed catheter valve with the new valve cap. Tear open the remaining 3 packets of alcohol swabs and place them in the middle. Remove the backing paper from the transparent dressing, label as 1, and place it on top of the blue wrap with the sticky side facing up. Gently clean the skin around the insertion site with a new alcohol swab. Do so in the circular manner. Use a new alcohol swab to clean the skin further away from the insertion site. Gently clean the length of the catheter in the downward direction using a new alcohol swab. Do not pull or tug the catheter. Place the new foam dressing at the insertion site. Coil the catheter on top of the foam dressing. Place the gauzes over the coil catheter. Ensure they fully cover the catheter. Apply the transparent dressing over the gauzes and remove the fixation strips according to the number indicators. Make sure the 4 sides of the transparent dressing stick nicely to the body. Record the amount and characteristics of the drain fluid. You will need to dispose the drain fluid and use bottle properly. First, remove the cap from the bottle and break the aluminum seal with the tip of the cap. Then, carefully pour the fluid from the bottle into the toilet bowl and flush it. Finally, place the empty bottle in a waste bag. Seal it tightly and discard in the rubbish bin. Take note, this used bottle cannot be recycled. With practice, this will get easier. Remember to follow the steps and wash your hands before and after handling the catheter. Thanks and bye!